NITA was created to fill a void for families who had a loved one who was struggling with an eating disorder. These families were unsure where to turn for help and treatment. Mental health providers were unable to keep up with the demand for their services, and educators saw a tremendous lack of understanding about these disorders. Small community-based organizations began to spring up in the early 80s and the 90s to share information and to work towards preventing eating disorders. But these homegrown organizations were not effective enough alone. So they banded together, and the National Eating Disorders Association was created in 2001 to provide a strong, more cohesive, and clear voice to represent individuals and families affected by eating disorders, and to really get something done on a national basis. Since we began, our mission has evolved to not only truly support individuals and their families affected by eating disorders, but to serve as a catalyst for change and progress in this whole field. By that, we mean to work in the areas of prevention, education, and access to care, and certainly expanded research. That doesn't mean that we actually do all those things hands-on, as we do not do research or treat people, but we advocate for these things and help people reach their goals through education awareness and, of course, through our national helpline. Our mission is for everyone touched by these illnesses to know that they are not alone. There is no doubt that for years there was a terrible misunderstanding and stigma surrounding eating disorders, but not anymore. The only shame of eating disorders is that our country has been turning a blind eye to their seriousness, and the kids, and certainly adults, who are living with these illnesses have gone untreated. When a person learns that they are not alone, that they are dealing with a biologically based illness, and that no one is at fault, we have a better chance of steering them and their families to the help they need. This is why the work of NITA is so very, very important. It is disheartening to learn about how many people have gone through their life savings, their retirement funds, or taken second mortgages on their homes just to help a loved one get the treatment they need. It is usually very, very expensive, and insurance rarely or barely covers many of the costs. If we can identify and diagnose these disorders early, we can often defray the costs emotionally, physically, and financially of the severity of an eating disorder for the patient and for their families. Unfortunately, this is not always the case, so we at NITA continue to advocate for access to affordable, quality treatment, but we also try to educate the public on how to recognize the signs and symptoms of eating disorders. We have a very, very large mandate because so much of the work just has not been done yet. Eating disorders have not been on the national radar in the past years, but they are today, and we're very proud to say that we believe NITA has been the primary catalyst of societal change in this field. Our efforts to get the word out are succeeding, and the demand for our services is growing beyond our current capacity. We need to scale our organization up to meet this need so that families who are struggling can get the support that they need. In the short term, we need to strengthen the many programs we already have in place and to enhance our ability to respond to the demand, whether it's our NITA navigators to provide support, our national awareness campaigns, or our toolkits. We are trying to improve on every single one of our programs. We have recently relocated to New York City, where our potential volunteer base is amazing, and actually it's exploding to the point that we are securing larger space and seeking funding for a full-time volunteer coordinator. We want to make sure that we're available to provide support and resources through our helpline and the web to those who really need it, and we intend to continue to strengthen our presence and our voice to inform the public of the seriousness of eating disorders. In addition, our STAR program for advocacy is advancing gradually to promote change in the mindset of the public about eating disorders. Understanding that advocacy is not like instant coffee, it doesn't happen overnight. We know it takes time to brew, but we see our advocacy slowly and progressively making a difference. We want to begin work on the front end of eating disorders once again, as we now know through research that the media does have an impact on poor self-esteem, poor body image, and ultimately eating disorders. The public is inundated by media messages containing photos and images that have been digitally altered. Every day, young people are comparing themselves to these unrealistic standards. NITA plans to follow the lead of other countries that are fighting back for responsible advertising by having advertisers disclose when a photograph has been altered, right there on that ad. In our schools, as we watch the dangers and negative impact of body mass index testing, we intend to fight for eating disorder screenings to combat the overreaction in this country to childhood obesity and to intervene by recognizing the problems earlier. In the short term, NIDA wants to create an environment where quality care is accessible and affordable, and early detection is just a way of life, no different than detecting other common illnesses. Our hope is that serious investment will be made in the prevention and treatment of these deadly illnesses. Currently, our challenges are so multifaceted, and we have only been addressing them for the past decade. We have a lot of work to do. But each time we learn of the death of another young person due to an eating disorder, it strengthens our commitment to press on. The strength of NIDA is its people. Seriously. Our board is comprised of some of the best experts in the field and is balanced by motivated family members, along with a really dedicated staff. When we made the move to New York, all our key staff moved across the country with NIDA. That says a lot about the dedication of our people. They are the strongest leverage points we could have. Beyond that, our strategy to create and build on programs using input from family committees is invaluable. So many organizations move forward based on surveys, and then they decide what's needed. We survey, but we then invite some interested NIDA partners and members and professional experts to help us mold and develop the programs. We truly value responsible and respectful input, and we listen. This practice has inspired our creativity, and since we work with a very limited budget, our brainstorming has evolved into serious programmatic work. Because we are now in New York City, we are uniquely positioned better than ever to take advantage of the media presence as well as access to a large volunteer base. We are very accessible to the public, often to the surprise of many. We receive calls, emails, and letters from all over the country, and sometimes the world. We answer, we respond, and not with just a form letter, because it's personal to us. We believe that real people with real concerns deserve real, genuine responses. Again, it's our people, our style, and our approach that sets us apart. NIDA is primarily responsible for the shift in public perceptions about eating disorders, and that has set us apart. We've conducted research to better understand what people know and don't know. We conducted focus groups and ultimately a national survey to test our progress. We continue to test our messages and our programs. We are also very polite but forward in our outreach to other leading organizations, and as a result, we have now just formed another new partnership with an insurance company, which is usually not a normal alliance. We are members of the National Institute of Mental Health Alliance. We have strong partnerships with our professional community, and we continue to forge relationships and partnerships with many national organizations with whom we have shared concerns. Our political experience and expertise has established us, and we are uniquely qualified to begin effecting change not only in state capitals, but now also at the federal level of government. We're very excited about bringing our constituents to the legislators to impact the field of eating disorders as it never has been before. Aside from the people who make our organization effective, we have incorporated strategies that you don't see everywhere. An example is our Media Watchdog program. People write to us all the time, asking us to combat poor and dangerous media messages. In today's environment, we could be doing that full time because of the extremism in diet advertising, the obesity wars, and digitally enhanced ads. So we really have to pick and choose our fights and decide which are the most negative. There was a yogurt ad that we received many, many complaints about, and the public really had a right to complain. Rather than organizing a letter writing campaign, I contacted the president of the company and asked if we could talk about it. They arranged meetings with key people. We politely educated the company, and believe it or not, they took the ads off the air. We then encouraged our public to thank them. In short, we give people the benefit of the doubt, trusting that most people and companies do not intend to do harm. This strategy has been effective with television programming, print ads, and so forth. We don't always win, but we have a fair share of victories. Education on these issues is a must in everything we do. The ultimate measure of success for NIDA's programs is whether the results are providing a positive impact for the people we serve. Too many times people consider outcomes by simple numbers rather than quality. We try very, very hard to measure by impact and proportion to size. Our state advocacy program is one example. We have one staff person assigned to the program to train volunteers in various states, provide materials, regular conference calls, etc., to help them move legislative action in their states. On our limited budgets and with talented leadership and passionate volunteer advocates forming coalitions, we have had actual legislative victories in several states. However, in those cases, it is a very slow process. We have now tested the hiring of a professional advocate in one state, Virginia. Within 1 year, we already have a significant success and victory. By bringing our knowledge to the expertise of an on-the-ground professional advocate, and with the help of experts and volunteers, the process moves much more efficiently and effectively. It's our hope that we could have such representation in every state at some point. Our surveys and focus groups also measure our progress. In 2003, we retained a research firm and held focus groups to determine how much people really knew about eating disorders and what was lacking. We learned that people knew much more about eating disorders than we had anticipated. However, we also learned that even with the knowledge that these are biologically based illnesses, those surveyed said they would not tell anyone if they or a member of their family had an eating disorder. The shame was huge. That's when we knew one of our primary strategic priorities had to be getting the word out that eating disorders were illnesses, not lifestyle choices. We did that through major media outlets with pro bono advertising. We also hired a PR firm to get our speakers out in the press at every possible opportunity. We looked for every avenue we could, including ringing the bell at the New York Stock Exchange 3 times. We wanted eating disorders to go public. 7 years later, the same research firm conducted a national survey for us. These results showed that 95% of those surveyed would now, in fact, talk about the illness and most likely seek treatment. Our communication tactics were proving very successful. It is so painful for us to know that eating disorders have the highest death rate of any mental illness, and yet so few people in this country realize this fact. Trying to communicate this publicly is complicated, as we don't want to alarm people who have someone in their family struggling. In addition, if we use that as a scare tactic, it may send the wrong message that someone chooses to have an eating disorder. So we walk that line ever so carefully as we constantly stress the importance of seeking help early and encouraging early intervention. A common misconception that if we just feed people, just get them to eat, everything will get better. Well, eating disorders are not really about the food, but food behaviors are the way this illness shows itself. In addition, unlike other mental illnesses, eating disorders are not only brain disorders, but also they have severe physical ramifications. The physical complications that can result range from early osteoporosis, kidney damage, esophageal damage, reproductive health damage among women, digestive tract problems, and of course, ultimately, and potentially death. So, knowing how dangerous but also how complicated eating disorders can be, NIDA is the translator to patients and their families and friends. As mentioned before, the needs of our program should continually develop from listening to those affected. In addition, our strength is then not only in listening, but also in creating, developing, testing, and implementing programs, ultimately connecting those in the eating disorder world to one another. No one should ever feel alone anymore, and no one should ever be ashamed again. We have created a community to help people move forward in treatment and hopefully recover, and then learn to help us help others. That is exactly what is happening. You can see that in our junior board, in our parent, family, and friends network, and certainly in our NIDA Navigator program. We are constantly amazed by the number of substantial programs we have developed and grown in the very short time that we've been established, and within the limited funding that's been available to us. The National Helpline that walks people through the steps to seek treatment 5 days a week is an amazing program. A professional staff leader leads it, but it operates daily because of the effective training program for our volunteers. We have waiting lists of volunteers who want to help, and that is very empowering for us. The annual conference that we first launched in 2003 was really a first of its kind in this field. It was the first to invite professionals and families all in the same space and exchanging information and support. We hear gratitude from the experts who are learning from the families as much as from the families themselves. It was a gamble to see who would come. Seeing the two communities coming together and learning and supporting one another is very, very gratifying. Our advocacy efforts have been terrific. We have played a strong role in the field with our partners in state legislation, and we have influenced both legislation and funding for eating disorders on a state level, but we are just scratching the surface. And finally, the Navigator program. Trained friends, that's what I call it. They have exceeded our expectations in seeing how effective and helpful it is, and how quickly the program has grown. Again, this program has a waiting list of people wanting to be trained. The new interactive teen website we have developed, www.proudtobeme.org, is a powerful tool. We are on the right track not only in trying to save lives, but in attempting to get ahead of the curve at the front end before people get so sick. This is a recent shift toward focusing more on prevention among youth. We are empowering them to become more critical of the media and active in their communities to raising awareness and educate their peers about eating disorders. In 2011, we held our inaugural Teen Summit at our annual conference, and were amazed at the abilities and the strengths of the young people who attended. We are now going to make the Teen Summit an annual event and tie it into the Proud to Be Me program. Another accomplishment is the fact that in recent years we have developed toolkits for educators, parents, and coaches and trainers, and that all of our materials are available online, completely free of charge. Underwriting this project wasn't easy, but we felt it was so important to remove cost as a barrier to our resources and to make sure they're available to everyone who needs them. Our effort to increase responsible media coverage of eating disorders has been successful. We have been getting stories in major print and television outlets, and we know we have made a significant impact in improving coverage and raising awareness of eating disorders through the media. One of our biggest challenges has been funding. We are dealing with a mental illness that until recent years was significantly misunderstood. People have been ashamed to admit that someone in their family had an eating disorder, so they weren't signing up to serve on the board or host a fundraiser in their home or solicit funding from friends. And our most logical source of support, the families who are affected, have also generally had to self-fund treatment, or at least fund a large portion, as many insurance plans barely or rarely cover inpatient residential treatment. Unfortunately, by the time these illnesses have been diagnosed, many people are so ill that outpatient treatment often was not an option. Inpatient treatment can cost $25,000 to $35,000 a month, with an average stay being between 3 to 4 months. So, those who seem like a natural donor base have been unable to help. We hear the stories every day of families taking out second mortgages on their homes, going through their retirement accounts, or through their life savings just to pay for treatment. And what else can you do if you have someone with a life-threatening disease? You do everything you possibly can. So funding has been unusually challenging. We have gratefully started to turn some corners because of our expanded educational awareness and outreach. We now have several corporate leaders taking an interest in our cause, and we hope to build on that support. The new proudtobeme.org website we recently launched was as a result of a corporate grant program. The grantors recognize that our programs are very innovative and can serve our communities well. The other challenge we've had has been getting the public to really wrap their hearts and minds around the severity of this illness and to help us save lives. With additional resources, we could build our advocacy program nationwide to empower families to use their stories as a catalyst for change. By educating policymakers, we hope to implement eating disorder screenings in school. These screenings would provide a significant means of raising awareness and improving early recognition and intervention. We now have sponsors for this legislation in the state of New York and Florida, and will soon have sponsors in other states as well. If we're able to achieve standardized school screenings and youth begin to be identified and treated before their illnesses become so entrenched, we could likely begin to see eating disorder rates decline over the next 10 years. Also, we know that the media does not cause eating disorders, but research definitely does confirm that media images can trigger low self-esteem, poor body image, and in some cases, eating disorders. Just as we know that secondhand smoke does not always cause lung cancer, but it is a factor in some cases. We have already started the wheels in motion to advance legislation, as is happening in other countries, to require disclosure on all digitally altered media images. This disclosure would begin the national conversation of priorities for our children and would certainly go hand in hand with bullying and suicide issues. With additional funding, we would bring our resources to more communities around the country. We already provide educational sessions for educators and parents occasionally when local communities provide grants for these, but it is so needed for us to take these educational panels nationwide. This would help to bring widespread awareness to the importance of early intervention and detection in eating disorders. We so want to help people before they become so ill. With additional resources, we would also fill the staff positions that have been on hold. As we see our programs grow, we must incorporate a full-time volunteer coordinator and communications and marketing consultant. And another area we have planned to expand, but really has been the most challenging to fund, is technology. In this fast-paced environment, we have determined that our website needs to be redesigned and restructured, and our internal technical systems no longer meet our growing needs. Our productivity suffers because we are still manually handling so many of our financial database transactions. We hope to be able to solve these challenges in the near future through the acquisition of better software and data sync programs. Ultimately, these enhancements would save us valuable dollars and staff time. We launched a task force in the summer of 2011 to study our many challenges and determine that one thing that could make the most significant contribution in our field. We've spoken with national experts from government, the insurance industry, experts in our own field, experts in comparable health fields, and of course the families who have experienced living with an eating disorder. The development of Centers of Excellence continues to top the list as a project that could make a substantial impact toward improving the quality of care as well as access to care and insurance coverage. These are all issues that are a primary concern to families affected by an eating disorder. While Centers of Excellence would not solve everything today, the model would certainly revolutionize our understanding and treatment of eating disorders. NEDA would not run them, but would establish an arm of NEDA to provide the oversight and coordination of expert panels qualified to select the centers, provide quality assurance, and measure effective treatment outcomes. One of the major shortcomings in this field is the lack of research and the lack of standardized measured outcomes. The lack of real, ongoing, evidence-based treatment and research is hurting our ability to convince insurers to cover eating disorders. In addition, if there were consistent criteria to measure outcomes and to track patients' progress toward recovery, we could ultimately develop better treatments for families in the future. Centers of Excellence could serve as a hub for research, training of providers, quality treatment, and expertise. Centers such as these exist for illnesses like cancer and cystic fibrosis and have been transformative for those fields. We have 24 million people with eating disorders in this country and an unusually high premature death rate. Establishing these centers of excellence is a necessary step to ensure that patients receive the care that they need to get better and care that they deserve.